Young Tyrone simply won't sleep. He's grumpy, he's grizzly, he's sobbing. You pat him and rock him, wrap him up and hold him down until he's drowsy, and then you creep out of the room. Within seconds, he lets out a howl loud enough to shift a Teutonic plate. You rush back in, do it all again, and same thing. Good God, will the crying ever stop?
When you become a parent, it's rather overwhelming when every single book has a different method to settle your baby. And joining us this morning to discuss the issue of controlled crying is Amanda Cox from parenting website Real Mums, and in Sydney, Anne-Marie Sampson, who established Night Nannies. Good morning to you both.
Good morning.
Good morning.
Good morning.
Let's start first with what exactly controlled crying is. What is it?
It's certainly moved on a lot over the last 50 years or so. The current thing with controlled crying now is actually called responsive settling, where you respond to the baby's cues. So you would put the baby down if the child cries. You may or may not leave it at that point, but you would certainly listen to the pitch of the cry. Is the crying getting worse? Is it getting better? And go back in and respond. 8 years ago when I had my first, it was you did the 1 minute, 2 minute, 3 minute method. But now it's just responding to the baby and how's the baby going and that sort of thing.
So this is the technique, the method that you would suggest works best?
It works best for me. I know it doesn't work best for everybody. It's certainly responding to the baby's cues, yes, I believe. If that's the method you're going to go, then that's the way you would approach it.
All right,
definitely.
Anne-Marie, what do you have to say about controlled crying?
Well, we're completely against it. It's something that I was trained in quite a few years ago, and it didn't sit well with me as a childcare worker, but I still implemented that. But once I had my own baby, I felt really uncomfortable with that, and we researched lots of different methods to create a more gentle approach, which does involve attending to your baby's cues and also to them and their needs, such as when they make noise, which is crying, they're actually having a need, so that's why we respond to them.
So is there a name that you would put to your approach?
Well, we just call it the gentle settling techniques. We like to work with the parent to allow them to trust in their own natural instincts and understand that children do have needs, and when they cry, they're actually asking for our attention in whatever way it might be.
But just because a baby's having a bit of a grizzle, isn't the grizzling process part of the baby calming itself down before it goes to sleep? Or do you not think that?
Well, we do teach parents that babies do make different sounds when they're winding down, but not to let them go to the point of where they're actually crying and becoming distressed. You have to ask yourself, why is the baby crying? Is it because they are uncomfortable, they're too hot, they're too cold, they're in pain, they're hungry, before you actually take that step. And then we wouldn't advocate letting the baby cry it out or cry itself for a period of time before attending to its needs.
So Amanda, you're shaking your head in approval here. Is that the same kind of approach that you have?
It's a very similar approach. I think my concern is that a lot of what we're talking about with controlled crying are methods that were done in the 1950s. Now, we've certainly done a lot of...
The extreme end of it.
Absolutely.
So which is leaving your baby to cry basically until it cries itself out.
Exactly. And I totally agree with Anne-Marie that if the baby's crying, yes, you need to check. Nappies, hot, cold, all the rest of it. Once all that's sorted, then, OK, well, what's the problem? Are you just... I know my 7-month-old just gets so overtired that he screams, and the best thing I can do is put him in his cot and walk out, because I get totally stressed, and within a minute he's gone. I keep trying to settle him and he gets worse.
So is that something that he's learnt, or has he always been like that?
He's always been like that.
Right.
OK,
you were very lucky then.
I was. My middle one, on the other hand, was very, very cuddly, but, I did use the control crying, as it was called then, or I preferred controlled settling method with him.
Yeah. Okay. And look, I think that part of the argument here is about the degrees to which people go to controlled cry. And I think what the two of you are agreeing on is that, responding to your baby's needs is important, because obviously up until 6 months of age, all of the nurses say to you, if your baby cries, you should go to your baby. The problem is, of course, when people take it to the extreme and they will put a 6-week-old baby down at 8 o'clock at night and let it cry. This is what's causing you the distress, Anne-Marie, isn't it?
It is, because we've heard of people, like, even in the last year, who let the baby cry to the point of it vomiting. It's become so distressed that it actually vomits, and then the parent is told by a sleep expert to leave the baby or go and clean it up and walk away, and instead of attending to that baby's needs. And I just find that just completely disheartening, and I just can't believe that people still do that. But the problem is it is ingrained in society because it was from such a long time ago, and we have all of our grandmothers and mothers clubs who have learnt those methods that then continue to teach that or tell their children who are then pregnant that they must do this, they must do that, that you must leave your baby to cry. And that's just, there's better ways of doing things now.
There is this other method, isn't there? I think it's called the continuum method, whereby the advice is that you never put your very young baby down. You're always there. It's always off the floor. It's always being cuddled. Does that kind of method create a dependency upon the mother in order to get to sleep?
I believe it does, and I've got a lot of anecdotal evidence that it does with friends of mine in mothers' groups who have tried that, where they can't leave that. I've got a friend who's got a 5-year-old whose husband is still being kicked out of the bed at 3 o'clock in the morning. Oh. She can't leave the house because there's tantrums, those sorts of things. So I believe it does. It doesn't happen with every child, obviously, and I guess it depends on the amount of other contact they have with other people, how often they're left in the care of other people, but it's certainly something that I think is a big risk, definitely.
Amanda, how important do you think it is for babies to have this sense of independence, to have their own bed, to have their own little routine before going to bed, as opposed to being strapped onto their parents all the time?
For me, it's very high. I'm not a co-sleeper. It was the most traumatic thing I did in my life, and we didn't have any of the kids in the bedroom with us. They went straight to their own cot in a room opposite, so we could still hear
I must
them.
admit, I did the same thing, yeah. Our kids were in their own beds from the start.
I love my sleep too much. My husband loves his sleep too much, so every little noise was waking us up, and we couldn't deal with that, and it wasn't good for anybody. I really think it depends on the family. I don't agree with it. It's not something I understand. It's not something I would suggest anybody do. However, I would certainly support somebody if that's what they chose. Sure. I just don't get it.
Yeah, sure. It didn't work for you.
No.
Well, Anne-Marie, what do you think about this continuum method, about the answering baby's response when the baby cries, you feed it, you pick it up, you...
Well, obviously that's the extreme opposite to the Verity method that was shown on that program, and I mean, it's not something that we practice or encourage, but it is something that we feel it's up to each individual family, and parents that we worked with, some of them do follow attachment theory with attachment parenting. And that does involve that. I don't think it is going to be traumatic or hard to break that, because we do believe strongly in bonding and having the child with you and having lots of body contact to help develop that, so that they don't get anxiety or separation anxiety later in life. But in saying that, I think having to carry your child around for every day for 6 months of its life is pretty extreme. So it's not something that I would be practising or preaching.
And they're heavy little buggers as well. Especially after you've had a baby, you've got a dodgy back anyway. Yeah,
for sure.
How do parents determine the difference between a cry that is just basically an advanced grizzle and a cry that is an indication of distress?
I think mothers need to learn to trust their instinct.
They know.
And you know instinctively. Dads, I'm not sure about.
Absolutely.
But
there are still those mothers, I'm sure, that practice this controlled crying, where they let the child scream and scream and scream in the bedroom, close the door. I mean, how do they feel about walking away? I mean, that must be very distressful for a mother in particular. I know it was distressful for a father.
I actually encourage mums to do that if they are in the room with the baby who is crying and mum's not coping.
Yeah.
I think mum needs to see how she's coping. If it's distressing mum, sure, get in there and do what you need to do. But if mum's really not coping, absolutely, walk out of the room. Best thing you can do, walk out of the room. The baby is in greater danger with you being in the room in that state than it is being left to cry.
Amanda, do you believe it's abuse, as has been indicated in some areas, to let your baby cry like that with controlled crying?
I'm very passionately against the term abuse in this respect, because I've worked with a lot of people who have been abused, and I'm very, very passionate about this. I don't believe it's abuse. I have seen instances where mums have been bullied and abused because they follow the controlled crying method, and I think that's more abusive than what the mother's doing to the baby. I think my greatest issue with it is, again, we're referring to this thing that was happening you know, over half a decade ago, and it's the thing that keeps coming up and coming up and coming up.
It's still being used.
Absolutely, and I think the reason it's being used is, you know, we're hearing Claire Verity's name a lot, we're hearing Tizzy's name a lot, we're not hearing Night Nannies, we're not hearing Pinky McKay. And so when a woman walks into a bookshop and she's got this wall of books at her, and she's going, oh my goodness, and she goes, Claire Verity, I know that name. You know,